this is something that is global. It's affecting the entire planet. We've seen through the spread of the pandemic or the virus itself how it highlights inequalities and kills people who are disadvantaged in almost any way you can imagine. We haven't got the evidence of that in terms of queer communities, but we certainly have in terms of people of colour, black and minority ethnic communities. And the only way we can, as collectively as humanity, prevent this from furthering healthcare inequalities is to jump on board and go, okay, well, this isn't about me anymore. This is about saving other people who I've never seen, never met and don't know, might be impacted on my decision to take the vaccine. That motive, which is a really central motive that we all have within us if we can find it, to be a part of something much bigger and be in it together, that's a single reason to have the vaccine. But the bottom line is this is our only way to achieve some kind of healthcare equality. So yesterday I did my first session in a vaccine clinic. There's something really magical going on. Undercover healthcare system that's in operation all over the country, and the mobilisation across the country has been extraordinary. It's probably one of the best things we've done in the UK since this pandemic began. It's the sense of pulling together, we're all in this together in the vaccine centre. We're drawing up an exactly equal amount of vaccine for every recipient. And that feels very powerful. But only if people are feel able to come forward and access what's available to them. But the reality is that the technology is very sophisticated. I really do believe the risk is small. It's something we're all in together. The virus is not going to go away. Other viruses will come, and this has always been where we've been headed with managing viruses, from the flu vaccine to this mass vaccination campaign that we're seeing unrolling across the country today. Okay, so I see what's happening with the vaccination program as being almost like in parallel but separate to standard healthcare delivery. What's really palpable is a sense of community within vaccine centres. So I can categorically say that when people walk in who are from minority communities, they will feel something that they don't normally feel. And one of the key things is that we're monitoring ethnicity and clearly asking that question of every single person that walks in. Now, my belief is that inequality arises in healthcare through not being seen, and not being seen means you're not being counted. If you are asked a question about your ethnic background at a point of interaction with a healthcare professional, something changes in you because you feel recognised, a positivity that says you matter. And if you can embody that and come along on this massive ride that humanity is going on to vaccinate ourselves against a killer virus, then you'll be taking part in something that does help you to feel equal. So right now, the most important thing is that you're registered with a GP. And people who aren't registered with a GP, if you can, do so. There's no reason why a GP would turn you away at this time, and it is the most effective way to be on the wait list for a vaccine. The only group I'm worried about are people who are unable to register with a GP through any number of barriers of access to healthcare, whether that be through homelessness, poverty or language barriers. But I'm aware that provision is being made to reach these harder to reach groups. So if you want your vaccine, hold tight. It'll come to you via your GP. If you've had COVID, you will have made some antibodies in your bloodstream. But unfortunately, due to the studies that we did last summer, we know that you probably won't hold those antibodies in your body, which means that you can be infected with COVID a second time or a third or indeed multiple times. And that's another reason why the vaccine program is important. The virus is mutating all the time. It's going to change and we're going to have to adapt with it. However, at this point, I think it's wise for everyone to jump on board. If you've had COVID in a period of time prior to being offered a vaccine, you should wait. The recommendation at the moment is 4 weeks. So if you've had a positive test or you've had symptoms of COVID and you're invited for a vaccine, get back in touch with the people who've invited you and ask to be delayed until the 4 weeks have passed. Any vaccination can give you side effects, and it's not uncommon to get minor side effects from this. So when I had my own vaccine, my arm was really sore for a couple of days, a feeling of being bruised. I was quite tired, a little bit feverish and headachy for about 12 hours in the second day after I'd had the vaccine. So just a very minor response that reassures me that my body is actually making antibodies. So none of that's to be feared. It's also important to know that after the first vaccine, you're not going to have any natural immunity to the virus for a good couple of weeks while your body gets busy with the vaccine material making you immune. So you need to carry on being careful, and because this is not a magic wand to make it all go away. Depending on how your own GP surgery has organised themselves, it's likely that you'll be going to a vaccine centre that's not actually at your GP surgery, but somewhere larger. In and around Brighton, we've got a centre open at the racecourse now, as well as in the Brighton Centre. And the vaccination centre that I'm using is over in Portslade at a medical centre that's really sizable. So there's room there to allow for social distancing measures and everything that you might expect for a COVID secure environment. You might find a vaccine centre not unlike a testing centre if you've been for a coronavirus test, in that it's really very organised. You don't need to worry about what you're going to do when you get there, because you will be marshalled and directed. You may have to wait some time, but usually not overly long, because the appointment systems are working really well. So all you need to do is bring yourself for your vaccine, bring somebody with you if you feel uncertain or unsafe, and everything else will happen very easily and swiftly because it's all been organised. You will be asked to wait after a vaccine, depending on which vaccination you've had. You may be asked to wait for up to 15 minutes to make sure you don't have any adverse reactions. I've not seen one of those, and I'm not worried about them at all. That's just the manufacturer's stipulations. So overall, your journey through a vaccine centre might take half an hour in total, and I think you'll probably have a really pleasant and uplifting experience. There will be people who are worried about getting the vaccine, and you might not, if you feel anxious, really understand why you're feeling anxious. Sometimes it'll be because you've read things and you don't really understand the science, or you find the science a bit overwhelming. Sometimes it's a fear of needles. For lots of people, it's about coming out of the house for the first time in months and months and months, and that's really, really difficult. Don't worry, if you're feeling any level of anxiety about getting this vaccine, you will be in very good company. It's fine to bring someone with you if you need to. You'll find that the staff and team that are looking after you while you're having your vaccine done will be really sensitive to your needs, and we understand that people are really anxious at this time. The most important thing to hold on to is the fact that it's a very quick injection. It really doesn't hurt. It's just that you're taking part of in order to defeat a viral pandemic, and that's a pretty impressive thing to take part in.